Good evening, everyone. This is Dr. Marty Ross, and this is another combination with Marty Ross MD tonight. This is where we talk about Lyme disease. No 2 weeks are the same. We create the webinars based on your questions. So I hope you'll ask away. At this point, I opened the webinar up a little bit late, so I don't have many questions. So those of you that have been wanting to ask questions, this is your chance. Usually I'm not able to get through all the questions, but I'll try to get through as many as we can. For those of you that are new to the webinar, welcome here. I'm glad to have you here. For those of you that keep coming back, I'm glad you keep getting value out of this. And for what I hear, a lot of people do learn some things from here, so I'm glad to keep helping people with these webinars. The way you can participate is to write a question. And so over here on the right-hand side of the screen down at the bottom is a chat box that you can write your question to me. The only thing I ask is try to keep your questions brief. If you get really long, they're too complicated for me to handle in this kind of a format, and it gets hard for me to display on the screen, okay? So please keep that in mind. The other thing, don't hit the enter key until your whole question is done. If you hit the enter key during the middle of the question, it actually sends multiple questions my direction, which gets to be hard for me to manage, okay? So I am creating a recording of tonight's webinar. And tomorrow morning, somewhere between 9 and 9:30 p.m. or a.m., not p.m., a.m., Pacific Standard Time here in Seattle, I will send that out to you. And it'll have links to sign up for the next series of webinars, which begin in February, and also have a link in there to find where the recording is too. If you happen not to get that email, there's multiple places you can find copies of the recording. One of those is at my practice website on the homepage, which is martyrossmd.com. The other place you can find it is at my Lyme information site called Treat Lyme by Marty Ross MD, which is at treatlyme.net. You can find that on the webinars page. And then finally, the other website you can find it on is my store, which is Marty Ross MD Supplements. And the URL for that is treatlyme.com. Okay. I also put it on my Facebook page, which is facebook.com/treatlyme. All right, so there's multiple places to find it if for some reason you don't get a copy of that, okay? All right, so let's go ahead and get started with our questions here. Hello, Karen. Let's see, what is your opinion of SOT? So Karen, I don't know, because I'm not familiar with what you mean by the initials SOT. If you get a chance, write that question to me again and spell out what you mean by SOT. Initials mean different things to different people, so I want to be clear what we're talking about. Okay? All right. Thanks for the question. Hello, Kara. Let's see. I noticed the brands in your store do not say liposomal artemisinin. Is liposomal artemisinin more effective than other artemisinin? Are there liposomal brands you'd recommend? I heard Dana Paris say liposomal artemisinin helped her with her Bartonella. Also, as far as Research Nutritional's transfer factor L plus goes, can we get the gelatin capsule and take the contents in water? Any contraindications to using transfer factors? All right. So let me talk about liposomal, what that means. All right. So first of all, liposomal is supposed to mean, I hope you heard the words I said, supposed to mean, that basically the drug or the herb or whatever we're trying to get into you is microscopically wrapped inside of a layer of fat. Okay, so inside. So you create these little fat balloons or little fat vesicles, microscopic little fat vesicles, and on the inside is where the drug goes. Okay, that's what liposomal is supposed to mean. All right. There's a lot of companies out there naming their stuff liposomal, and it really is not liposomal. So there's a lot of companies that are calling liposomal something that they mix fat into as a means of getting, of supposedly increasing the absorption of that substance. The products that do the best job of getting absorbed in some situations are true liposomes where the chemical is put inside. So for instance, on my supplement store, I use a curcumin product made by, called Mariva 500 by Thorne. They're using true liposomal vesicles to carry the substance, okay? And there are a number of other companies, such as there's, I think it's called Physician's Design or something, that uses a liposomal oregano that is not liposomal oregano. In fact, I don't think there's a true liposomal product out there for oregano oil, because most of the products I've looked at are actually just mixing fat into the oil. They're not microscopically wrapping it. All right. I am not aware of a true liposomal artemisinin. All right. Also, what I would say about artemisinin is I think artemisinin is not used to treat Bartonella. It's used to treat Babesia. All right. So the substances I use for artemisinin, I use products by Research Nutritionals and also by Allergy Research. I find good effect, which means they must be getting absorbed well. All right. That's the end. So the main thing you want to know is, are they ultimately being absorbed well? Okay. In terms of the transfer factors, the capsule is mainly meant just to hold it so the stuff gets into your stomach, all right, to get it down into the stomach. In theory, you should be able to mix to open those capsules up and either try to put it in water or in some kind of a liquid that you can swallow and then get it into the stomach, and it should still work well, okay? Any contraindications using transfer factors, only if you've ever been allergic to them. And the only way you're going to find out if you're allergic to them is try them. Other than that, I have no contraindications to using the transfer factors. Okay. All right. So everyone, let me just talk about transfer factors real quick. So transfer factors are a group of proteins that are made by certain types of white blood cells to turn on and turn on other parts of the immune system to actually fight an infection. Okay. And these, our white blood cells can actually help target the immune system to fight certain infections. And each kind of infection that is in us, ultimately the immune system, these immune cells will make a transfer factor that targets that specific germ. So for instance, there are transfer factors that can be made to target the immune system to fight the Lyme germ. There are transfer factors our white blood cells will make to treat the Bartonella infection, et cetera, okay? So there's a company called Research Nutritionals that has developed a number of transfer factor products targeting certain infections. So for instance, their transfer factor L plus has in it transfer factors that fight Bartonella, Babesia, Ehrlichia, Anaplasma, Lyme, which is Borrelia, a number of viruses, and I believe chlamydia pneumoniae. Okay, so that's what theirs does. That's one pill twice a day. They also have a different product, which is called transfer factor multi-immune. And what that's doing is that's specifically turning on a type of, I'll call it front-end white blood cells, something that's supposed to fight all kinds of infections. Those are called natural killer cells. They have a product called transfer factor plasmic that has in it a number of transfer factors that will turn your immune system on to fight various kinds of viruses. They have another product called transfer factor Enviro that is made of, that has transfer factors in it that target your immune system to fight mold toxins, for instance, okay? So those are the various kinds of transfer factors that they have. But transfer factors, again, are proteins naturally made by your white blood cells to target the immune system to fight specific infections, okay? All right. Thank you for that question, Karen. Good luck to you. Oh, let me just do a quick screen share here, everyone, in case you happen to miss what I said, which transfer factor is used for which situation. In my Lyme disease information site, which is Treat Lyme by Marty Ross MD, if you look at my online guide, and then if you look in the immune system chapter, take a look at this article called About Transfer Factors. In here, I describe how the transfer factors work, and then I talk to you about the targeted transfer factors right here in the middle of the page, and I tell you which one of those products work for which infections, okay? All right. Thanks for the question. Hello, Steve. Hi, Dr. Ross. I'm 3 weeks into a disulfiram treatment. I started off on 100 milligrams a day for the first week. Then the second week went up to 200 milligrams a day. I'm now on 300 milligrams a day. My goal is to reach 500 milligrams a day in February, as the way forward with disulfiram is to go low and slow. I have had no really bad side effects so far, i.e. no pain or neurology symptoms. The only issue is I have been sleeping 9+ hours a night, as before I only needed 7 hours, and do not feel tired more than I used to, have no sexual appetite for my wife, I always have in the past. In your opinion, is this normal to feel this way while on disulfiram? So, there's a number, in any medicine we take can cause anything. Okay, so there's a Marty Ross rule of thumb, which is anything can cause anything. All right. Okay. Now, when we look at disulfiram in the world of Lyme disease, the two major side effect problems that people are getting is either neuropathy or people are getting psychiatric symptoms like depression, anxiety, sometimes hallucinations. Okay, those are the two major things that might happen. But there are other things that can happen. So it's possible that maybe the disulfiram is giving you some increased sleepiness. All right. It is possible that as a side effect, the disulfiram has also decreased your sexual appetite. And I think actually that may even be a known side effect of the disulfiram. Actually, let's look at this together. Let's look online here. We'll flip that up. I don't always remember every side effect of everything, but I have to look things up sometimes. So let me do a screen share and we'll look and see. All right, so disulfiram side effects. All right, so this is from WebMD. Let's see what they say. Okay, so headache, acne, drowsiness, tiredness. Maybe that's why they list that as one of the things. Just trying to see if they say anything about sexual. Doesn't look like they say anything about sexual. Let me go. I want to go back and try a different page here. Let's see. Okay, so drowsiness or tiredness, they list on this site. Impotence, they say. So that would mean difficulty getting an erection. So maybe that is what's happening with you in terms of the side effect there. Okay. All right. So there you go. Let's see. I wonder if there was another part to your question. Yeah, anyhow, I think I answered your question. All right. Thanks, Steve, for that question. Good luck to you. Hello, Irina. Let's see. Dear Dr. Ross, so happy to be here to listen to your webinar. I'm glad you're here. My daughter, a Lyme patient, doesn't take any supplements currently. Tested very high for the following markers: vitamin B12, cytomegalovirus, complement C4A, anti-DNase B, strep antibodies, HHV6 Ig, ferritin, candida, multiple antibiotic resistant Markons. So I'm wondering what can cause high levels of vitamin B12 in serum and high ferritin levels. Could it be liver issues? Also, how one treats candida and staph infection at the same time. Thank you. Okay. So in terms of vitamin B12, the most common reason people get elevated B12 is it's in something you're taking. So some kind of vitamin, whether it's a multivitamin, a B complex, often that is the cause of B12. It usually is not going to happen just on its own. Your diet source of B12 tends to be red meat, actually. So vegetarians, for instance, will often have low B12, but B12 comes from our diet more in the terms of red meats. It's going to be a source for that. Ferritin is iron, and a source of increased is the iron stores in the body. It's how we store iron in the body. And if it's elevated, it means you have increased iron. Okay. Now, that sometimes can happen as part of a genetic problem where you build iron up in your body, and that's a condition called hemochromatosis. You may want to look that one up online, okay? And the only way to know if you have hemochromatosis is dependent upon how high the level of the ferritin is, and there's a genetic test that you can do to look for it too. So if there are elevated iron levels and the person is not taking supplements for it, then sometimes, depending on how high that ferritin is, we sometimes want to do further testing to make sure you don't have this liver condition called hemochromatosis. Okay? All right. Now, in terms of the staph, which I think what you're referring to is the Markons, which is methicillin-resistant coagulase negative staph. I think I know everyone's tested for it. I think it's a hoax. I just want to say Markons is one of the biggest hoaxes. And let me tell you why I'm saying that. So the person that brought this idea of Markons to our attention is a physician named Dr. Richie Shoemaker. Shoemaker is a physician that was the first one to describe that people can have what's called mold toxin illness. And he was able to show through a bunch of science that about 25% of people, when we breathe in, drink in, eat in mold toxins, that we are not able to get rid of them. Okay. That was him. He was the guy that discovered that. Okay. And in his elaborate theory of things, what he did is if he had people that were sick and he figured out they had high mold toxins, the first thing he would do to get them well is to remove their mold toxins, try to remove them. Okay. And if he thought he had removed their mold toxins and they still were not sick, then he started thinking they might have something called chronic inflammatory response syndrome, meaning that for some reason they had other causes triggering their ongoing inflammation in the body. Some of these might have been set off by first having too much mold in them, okay? And one of his theories was that one of the reasons people would stay chronically inflamed after they got their mold toxins out is that they might have an infection in their nose called methicillin-resistant coagulation negative staph. This is a bacteria. Staph is a bacteria that might just live in the mucus linings of our nose, okay? Now, and so based on his theories, I used to try to remove this stuff. I used to try to use something called Beg nose spray. I used to also have people take an antibiotic called rifampin, and I would get rid of that. I would do cultures afterwards to make sure that the bacteria were gone. And I never saw anyone get any better for doing it. I want to be clear about that. I never saw health benefits in anyone for removing Markons, okay? Secondly, the problem with Markons is even after you remove it, it often comes back. And you have to keep trying to remove it again and again. And actually, it's virtually impossible to permanently remove. I think subsequently, based upon knowing that I never saw anyone get benefit from removing Markons, that I think it actually is a normal bacteria that can live in the sinus passages of a lot of people, and it does not cause health problems. I want to be clear about that. I don't think it causes health problems. And I think it's a nice theory that Dr. Shoemaker had, but I never try to test for it anymore, nor do I ever try to remove it because it doesn't make a difference when you remove it, and it's virtually impossible to get rid of, okay? Now, there are a lot of physicians that have been trained by Dr. Richie Shoemaker in his way of managing this, and so they just go out and do it, all right? In my opinion, when people have mold toxin illness and you remove it and they don't get better, the reason they may still stay inflamed actually is probably from having chronic Lyme, especially if they have Lyme, okay? Dr. Shoemaker does not believe in chronic Lyme. He thinks that people remain chronically inflamed for other reasons, but I think he's missing the boat in the fact that he doesn't believe there is something that's called chronic Lyme that could be keeping a person inflamed, all right? In terms of Candida, So first, okay, so it looks like when you say you have testing that shows Candida, it probably means that somebody measured antibodies against Candida, all right? So antibodies mean that your immune system has made these things called antibodies against Candida. Well, the problem with that is, and saying whether you have a true infection or not, is antibodies do not tell you whether you have a problem with too many yeast. All right. So here's what the issue is. Our intestines are lined with bacteria, viruses. There's some parasites that naturally live in our intestines, and there is yeast that lives in our intestines. When we're trying to see if somebody has a problem with the yeast, what we're really trying to see is, do they have too many yeast in the intestines? And because yeast naturally live in the intestines, just measuring that the body has made antibodies against those yeast does not tell us that there are too many yeast. Okay. So I don't think that using yeast antibodies is an accurate way of seeing if there is a too much problem. In my practice, what I do is I like to see if people have too many yeast by using a screening questionnaire to see if, based upon their health problems, do they have a high likelihood that too many yeast are present. And in my screening tool, what I have found, if somebody screens over 140, I have found really good benefit at treating for too many yeast to get rid of them. I'll show you my screening tool here in just a minute. Okay. All right. Now, there is, however, one probably very reliable test you can do to see if you have too many yeast, and that is actually to measure an organic acid. It's called an organic acid test. And one of the organic acids that's tested in an organic acid blood test is something called arabinose. And arabinose seems to have some reliability if it's elevated at indicating that you have too many yeast living in your intestines. It's an expensive test, though. So my approach is to look at the screening tool that I use, and if it suggests that there are too many yeast, that's usually when I'll wind up treating for too many yeast. The other time I will treat for too many yeast in the intestines is if I've got somebody that's doing better with their Lyme, or they've been in remission with their Lyme and suddenly they get worse. What I have found is often it indicates that maybe from it being on all those antibiotics, too many yeast moved into the intestines. Even a year, even 2 years after you stop the antibiotics, it can happen. Okay. And so symptoms that make me think of yeast in those kind of settings are sugar cravings, gassiness and bloating. Pimples or acne, believe it or not, get worse whenever somebody has too many yeast in the intestines. Often they do. A person that gets worse when they have sugar, that sometimes can indicate too many yeast in the intestines as well too. Okay. In terms of my preferred treatment approach, my first line for prescriptions for yeast is to use something called nystatin, coupled with a prescription called diflucan. My herbal option is to use a supplement that has caprylic acid, rosemary, and garlic in it, and that is a supplement called Capri Plus. All right. Let me show you where you can find out how to use those things, and I'll show you where you can see this questionnaire that you can download to see if there are too many yeast. All right. So let me do a quick screen share here. All right, so I'm going to go. I have up here in my online Lyme guide, I have a chapter that is called yeast. Okay, and so first of all, you could look at this article that I have about how do you diagnose yeast. It's called, "Is it a silent problem? Is it yeast?" And this is where I talk about how to diagnose too many yeast. And in here, you can see, there should be my questionnaire. Yeah, right here in the middle, there's this link that you would click called Yeast Screening Questionnaire, and there's my questionnaire. And if you fill it out, you score over 140, there's a good likelihood you have too many yeast. Okay. All right. And then in terms of, actually, I'll go back here. In terms of how you treat yeast, take a look at this article I have written called Kills Yeast, a Brief Guide. And in here, I have information about how to go after that yeast. And I talk about prescription, and there's my Capri Plus up here. Okay. So I talk about how to do it in this article. All right. Ooh, excuse me, everyone. Sorry for that sneeze. All right. I hope that answers your questions. Good luck to you. Thank you. Hello, Carrie. Let's see. I tested positive for Bartonella with an IgG of 3.54. I have all negative on 4 different tests for Lyme. Does LDN work for Bartonella and nerve sensations, like a vibration, shaking feeling in the left pelvis area and head and eyes? I have all normal nerve function for muscles, no numbness. I also have pressure around eyes and pressure closed and feeling around the head. Very strong. I do not have normal nerve pain. Can Bartonella cause your immune system to attack your sensory nerves? I tried LDN at 1.5 milligrams and nerves get even more shaky, excited. Why? On Doxycycline 100 milligrams for 2 months and now rifampin 300 milligrams for the last week. Thanks, Carrie. Okay, so let me discuss a number of things here. Okay, so first of all, everyone, it is possible that you can get Bartonella as one of the Lyme co-infections and not have Lyme, all right? Because that tick that bites you might not transmit Lyme. It may just transmit Bartonella if it has Bartonella. Also, there are other vectors that spread Bartonella rather than ticks. So mites, flies, not sure if fleas, but there are other vectors that can spread Bartonella as well too, okay? So it's possible that Bartonella is separate from having Lyme, okay? Now, a very peculiar symptom that I have seen that indicates Bartonella is when people have a sense of vibrating or buzzing, as you describe, okay? Sometimes that vibration or buzzing can be like a deep internal vibration or buzzing that somebody will feel, and it's just deep inside, okay? So I have seen people have problems with that kind of a feeling before too. In terms of low-dose naltrexone, I don't use it for Bartonella. I like using low-dose naltrexone if I've got somebody with autoimmune conditions. I like using low-dose naltrexone for people that have chronic fibromyalgia type pain. I like using it to modulate the immune system and people, again, that have autoimmune components to their illness, all right? So I haven't found it to be helpful in this kind of a situation. So I'm not sure, I don't think it would benefit you. Why it's agitating your nervous system, I don't know, okay? So everyone, what's low-dose naltrexone? So naltrexone, everyone, is a narcotic blocker. We use it for people that have opiate drug overdoses, and it binds to narcotic receptors in the body and boots the opiates off of those receptors, okay? We make our own type of narcotics in our bodies, and those are chemicals called endorphins. And the endorphins that we make regulate pain, but they also regulate the immune system, okay? And so there is we can use those, since naltrexone will bind to narcotic receptors, it binds to endorphin receptors as well. And so if you block our endorphin receptors, there's 2 things that happen. Number one, the endorphin receptors become more sensitive to the endorphins. They increase their sensitivity so that anything that lands on them that's an endorphin might turn them on, okay, in a sense, all right? Second thing that happens is the brain does not like the fact that those receptors have been blocked, and it sends out a bunch of chemicals to the endorphin-producing bodies in the cells and tells them, make more endorphins. So during the time that you have this endorphin blockade with Narcan, or with the low-dose naltrexone, what happens is that there are more endorphins that get produced and the receptors get more sensitive. So now when the naltrexone wears off after about 5 to 6 hours, or 4 to 6 hours, I should say, those receptors get flooded with extra endorphins and they're more receptive to those endorphins. And that does have an effect of turning down an overreactive immune system that we see in autoimmune conditions like rheumatoid arthritis, like ulcerative colitis, like multiple sclerosis, for instance, okay? All right. Occasionally, people that have remaining Lyme after they've been treated with antibiotics actually have an autoimmune illness that Lyme triggered. And so I might use low-dose naltrexone in somebody, say, a year or so into treatment. If they're not getting any better, I might do it to try to manage some of their Lyme symptoms under the possibility that some of their symptoms may be autoimmune illness triggered by having Lyme in them. All right. Now, the other thing that naltrexone does is it binds to a receptor on a type of immune cell in the brain called microglia. It binds to something called toll-like receptors in the microglia. And when it does that, it alters the nerve transmission of pain, which seems to be very helpful in people that have fibromyalgia or the myalgia muscle achiness that we get in Lyme disease and in fibromyalgia. All right. I have not really found LDN to be useful for people that have straight nerve pain or nerve sensations like you have. Okay. All right. Let me see if I made enough points that I wanted to make here. Oh, and then finally, the doxycycline. So in terms of my favorite drug for Bartonella, well, my favorite approach to Bartonella is to use at least 2 antibiotics at the same time, okay, of which the main antibiotic I love using is rifampin, and there's newer research that has come out suggesting, based on Petri dish studies, that it is probably our strongest Bartonella antibiotic. When you use it, make sure you're taking, as an adult, at least 600 milligrams one time a day, and you can even dose it up to 1,200 milligrams if you need to, all right? Now, you want to couple it with at least one other antibiotic that gets inside cells, and doxycycline happens to be one of those antibiotics, all right? Okay. The other thing I am starting to add to my Bartonella treatments, and this is just a new thing I've added over the last month in my practice, and I'll probably eventually going to see how this goes, and I may add it to my Bartonella treatments that I write about on the website, is I'm starting to add something called Methylene Blue into my Bartonella treatments. And Methylene Blue is a substance that we use to treat a hemoglobin problem called methemoglobinemia, but it's been discovered on Petri dish experiments to help treat what are called persister forms of Bartonella, and even can help treat persister forms of Lyme. So let me talk about persister forms real quick, okay? So with Bartonella and with Lyme, when we use antibiotics for a long time, some of those germs, some, not all, some of the germs will go into hibernation, and that's a persister form. In a hibernation state, they basically ignore the regular antibiotics like rifampin and doxycycline we throw at them. All right, so what Methylene Blue does, we think, is it destabilizes the membranes of the bacteria so that even though they're not growing, when their membrane gets unstable, the germ just dies, basically, okay? So I'm starting to add Methylene Blue, 50 milligrams, 1 pill twice a day, into my Bartonella treatments to try to prevent persister Bartonella from developing, okay? It also could, in theory, help to prevent persister Lyme from developing. So a lot of my treatments these days, I'm starting to add it into both of those treatments to see if we can deal with persister forms. It's too early for me to report back to everyone whether that's going to be an effective treatment or not. So you're not going to see me do a massive update at this point of my Lyme disease treatment article and my Bartonella treatment article and any information I have out there about persisters, but I'm going to see what happens with my patients, and I'll be glad to report back to you. This information about Methylene Blue is based on newer research that came out towards the end of 2019 by a physician named Ying Zhang. He's a medical doctor doing research on persister Bartonella and persister Lyme. And about a year and a half ago, he had another research piece he presented about persister Lyme, where he also found that the Methylene Blue is effective there too, at least on Petri dish, okay? Now I have to caution everyone, what we see on a Petri dish is not necessarily what happens in a human being. But because I've now seen it show up on both of these, I'm starting to add Methylene Blue into my treatments. Methylene Blue is a medicine that has to be compounded because it's not made in a pill form. And I've been using a pharmacy called Hopkinton Pharmacy out in Massachusetts to do that. They are able to compound that medication. Standard adult dose is 50 milligrams 2 times a day. Okay. All right. So I've just said a lot of things here. I'm going to show you a couple articles to take a look at. All right, so let's take a look at how do you treat Bartonella. I'm just going to show you a brief article on that if you want to see the various antibiotic combinations you can use. Again, I have not added anything about Methylene Blue into this article. I probably will over time if I see that it does work. Just take a look at this article here, and you're going to see various antibiotic combinations. And there's, for instance, I have these treatments that are called rifamycin, rifampin-based treatments. Okay, all right. And then in terms of the low-dose naltrexone, take a look in my immune system chapter. And I have an article about it. It's called This LDN for Lyme. And in here, I talk about the science that shows how it works, as well as give you dosing information about how you would start using it as well, too. Okay? All right. Thanks for the question. I'm sorry. I know that was really long-winded, but I wanted to address a number of things that you brought up there. Okay? All right. Good luck to you, Carrie. Hello, Jake. Let's see. Hello from the UK, Dr. Ross. Hello. I have a question regarding Bartonella being very difficult to test. My practitioner and I struggle to diagnose clinically. Have ongoing derealization 1 year, but no other typical BART symptoms apart from when I took a large dose of cholestyramine and suddenly got pain in the soles of feet and moving tingling sensations in my head. Since then, these symptoms have not returned. Do you think this is a cause for concern of BART infection? And do you have any recommendations regarding how to investigate it further? Have you had any luck diagnosing BART with performing challenge tests using Hootenea instead of Acuta? Continuing to follow your work. Thank you from across the pond. So first of all, I know there are some people that are using Hootenea and Sida Acuta and even ABART, which is one of the biorenite formulas, to try to quote unquote do a challenge test to see if somebody has Bartonella. And the idea I think that they're doing is they're trying to see, do you either get a temporary improvement or do you get a temporary worsening? If you get a temporary worsening, I want to just let you know that the Sida Acuta can kill Lyme, all right? So if you actually are getting worse on Hootenea and Sida Acuta, and they're taking that as a sign that Bartonella is there, be aware, it could be that you're killing Lyme. So I don't think doing challenge testing is a reliable way of seeing if you have Bartonella. In fact, we don't have a reliable way testing to see if you have Bartonella. Now, let me talk about that real quickly. So, and because of that, I generally make my decisions as to whether somebody has Bartonella based on what the clinical picture tells me, not on testing or challenge test, okay? Again, the problem with challenge testing is if you get a reaction, and maybe because you're killing something else like Lyme, that's giving you the killing reaction, not the Bartonella, okay? All right, so testing for Bartonella. So the problem with testing is we recognize that there are 15 strains of Bartonella that can infect humans. We think there's 30 strains total, okay, but we know that there are 15 that are thought to infect humans. And so to see about Bartonella, there's two general tests that we can do. We can do antibody testing, or we can do DNA testing called a PCR test to see if the germ is in you, all right? Now, when it comes to antibody testing, most labs are able to detect two kinds of antibodies. One of those antibodies is for something called Bartonella henselae. The other antibody is something called Bartonella quintana. Okay, those are the two common ways. Okay, recently, IGeneX, which is based out of California here in the States, it's a tick testing lab, has come up. I think. Not sure, maybe over the last year or two, they came up with a way of checking for antibodies using a Western blot method of looking for antibodies against 4 strains of Bartonella, including the henselae, quintana. I think they do Vinsoni, if I'm correct. There's a fourth one that they do as well too. Okay, but they're looking to see, do you have them against 4? All right. There is a lab out in the United States, out in North Carolina, called Galaxy Diagnostics. And what Galaxy has done is they've perfected a way of doing DNA testing, doing something called an enhanced PCR test. And their DNA method can detect the 15 kinds of Bartonella. The trouble is we don't have any idea how good they are at picking it up in people that are actually known to have Bartonella. And the reason that can be a problem is it may be hard to find the DNA of Bartonella in you, even if you have it in you, all right? And For various reasons, Galaxy Diagnostics, which I think has a good test, has never been able to go out and tell us when a certain strain of Bartonella is in a person, what is the success rate of their test at finding that certain strain. We don't know. So when you get back a negative test from Galaxy, even though they can detect all 15 strains, it's negative because their testing just missed it. All right. Even though it can detect 15 strains, that doesn't mean it can accurately see them every time that one of those strains is in there. And we don't know. Most labs are trying to do validation studies where they can tell us of known cases, what percent of the time can they find that infection. So for instance, IGeneX recently in their newer test called an immunoblot has been able to do validation tests where they can tell us in known samples of Lyme, their test has a chance to find it 95% or more of the time. They've done validation studies, okay? For various reasons, because it's technically difficult to do mostly, Galaxy has not been able to do these tests to tell us what percent of the time can they accurately detect a Bartonella infection when it is in a person. So we don't know, okay? So because of all those complications with how do we test for Bartonella, I tend to rely on symptoms. That's where I tend to go, okay? So let me read back through part of your question here. Very difficult to move. Okay, so in terms of derealization, that is a symptom that you might see in Bartonella. It would be rare to see it as the only symptom that you have of Bartonella, and it sounds like you're a physician and you have considered all of those symptoms. So common symptoms that I think of for Bartonella are regular ongoing pain on the soles of the feet in the morning that gets better as you go away. Your pain in the soles of the feet, I think, was more of a reaction to the cholestyramine and maybe a cytokine surge, but I don't think that's the kind of Bartonella pain on the soles of the feet that we see. Other symptoms that make you think of Bartonella are neurologic symptoms. Bartonella infects the nerves. Bartonella can give a lot of psychiatric issues like the derealization, sometimes bad anxiety, sometimes bad depression, sometimes hallucination, okay? Bartonella is known for giving stretch mark rashes. Bartonella is known for giving a lot of agitation to the nervous system. So you may have people that have buzzing or vibrating sound, feelings and sensations, for instance. Bartonella can give you a rash that looks like scratch marks or stretch marks. Bartonella can give you a type of air hunger, actually. So I know we tend to think of air hunger as always being babesia, but Bartonella can give you that kind of air hunger feeling as well, too. Okay, so there's some things to think about. Regarding the foot pain, though, you asked since it went away, do I think it means Bartonella? No, I don't think it means Bartonella. All right. Good luck to you here. I know you're in a tough situation. Sometimes if I don't have any, at times, even if derealization is the only symptom suggesting Bartonella, I might do a trial of treating for the Bartonella to see if it gets better. Okay. Keep in mind, whatever you do, if you do treat for Bartonella, you want to use at least 2 antibiotics that will treat it. And you need to give them a minimum of 2 months to see if they're going to give you some benefit at all or not. Okay. All right. Good luck to you, Jake. All right, everyone. In terms of the Bartonella, I just want to review, in terms of diagnosing Bartonella and the issues of testing, I'm going to do a quick screen share here so you can take a look at this later. All right, so take a look at my chapter on how to diagnose. And there is an article that I have published called How to Diagnose Bartonella in Chronic Lyme Disease. All right, and so this is the article where I review the science and the symptoms, okay? And evidently, in terms of what it can be transmitted by, I'm just going to read through here. It's transmitted by ticks, animal scratches, fleas, lice, sandflies, and mites, okay? So there's a variety of things that can transmit it, okay? All right. All right. Thank you for the question. Good luck to you. Hello, Linda. Let me get your question posted up here. Hold on here, everyone. Let's see. 1.5 years ago, experienced burning eyes, then a detached retina. I've struggled with pain and inflammation in the eye since surgery. Diagnosed with mast cell activation, the pain decreased in intensity with histamine blockers, but I still have some inflammation. My eye doctor wants me to use steroid eye drops, but I have used them in the past and it didn't seem to help. I'm cautious about using steroids in Lyme disease. Any recommendation? My eye doctor doesn't believe it's related to the Lyme disease. It's a tough situation. So if you've got an inflammatory condition of the eye, probably the strongest way to deal with that inflammatory condition is the steroid eye drops. On the other hand, if you have Lyme and it is the underlying cause of the problem, then sometimes using steroid eye drops can allow Lyme to get more active. I don't have a decent answer for you here. This is something you're going to need to keep talking through with your physicians, okay? All right. Good luck to you. Hello, Kathy. Let's see, what can I do about relapsing fever Borrelia symptoms? So there's a kind of Lyme, everyone, that's called tick-borne relapsing fever. One of the strains can be Borrelia miyamotoi, for instance, that can give that. And a pattern that sometimes people with it will get is fevers that go up and down. Okay, not everyone though with tick-borne relapsing fever gets the relapsing fever. All right. The way we treat this is the same way we treat Lyme. All right. So, Kathy, what I would do in terms of an approach is take a look at my protocol for treating Lyme disease. And it's the same things you would want to do for treating the relapsing fever. And that is get sleep, because that helps your immune system work better. Okay. Number 2, take things to lower inflammation cytokines. These are chemicals that are made by the immune system trying to get rid of Lyme, but the immune system makes too many of them. And then those cytokines actually give you a lot of the Lyme symptoms, and they actually can suppress the immune system too. Okay, so there's steps you can take to reduce those. You want to do things to support your adrenal glands with something called ashwagandha. Anyhow, there's a number of things to do that I build into my treatment protocol. Let me show you the treatment protocol, okay? There is not a specific recommendation I have on how to stop the temperatures from going up and down. A lot of that is based on decreasing the cytokines with curcumin that I mentioned. I'll show it to you here in a minute. But ultimately, you got to treat your germs to get the relapsing fever to stop. Okay? All right. So let me do a screen share here. All right, so if anyone wants to know my general approach to treating Lyme, take a look at my treatment protocol. The steps that I lay out here are the steps that anyone should do throughout their Lyme treatment to make sure that they get their body working well to deal with this, okay? So first step is get sleep, 7 to 9 hours. I discuss ways to do that here. Second step I like is to be on a healthy, I prefer a paleo type diet that's rich in healthy vegetables, and you can read about that here under my diet. Number 3, lower cytokines. And again, I like using curcumin as my main agent to do that. Be on something that helps your body deal with stress of all this, and that's the ashwagandha that I talk about here. Balance your hormones. I talk about that there. Be on a good multivitamin. Do some basic detox steps, especially use glutathione to do that. I don't have people do specific immune boosters because everything else I just mentioned up above takes care of your immune system. Get yeast out of the intestines if they're there. And then finally, treat your Lyme infection. And the things that I say about Lyme here are the same things you would do for the tick-borne relapsing fever. Okay? All right. All right. Good luck to you. Hello, Joyce. Hi, Dr. Ross. Thank you for all you do for us out here in Lymeland. You're welcome. Last week, you spoke about oil of oregano. What germ bacteria exactly does oil of oregano target? Please explain how to incorporate into treatment. I've used it for years for really bad colds, and it works well. Thank you so much. All right. So oil of oregano, based on research from Ying Zhang, I mentioned him earlier tonight. He's a medical doctor, again, that has a lab at Johns Hopkins University. He's doing a lot of petri dish type experiments to try to figure out what can treat persister Lyme and persister Bartonella. And he has shown that oregano can treat persister Lyme and the persister forms of Bartonella, just the persister forms, not the wild growing forms, but the persister forms. Okay. And so even though I mentioned it last week, I've been investigating a lot more because I've been trying to figure out who manufactures what is known as a liposomal form of this. All right. So let me step back for a minute. So I don't know if many of you that have been through Lyme for a long time may remember about 5 or 6 years ago, the rage treatment at the time, the it treatment of the season, the one that everyone was flocking towards, was that a lot of people were starting to do essential oils to manage their Lyme disease. And these were essential oils made by doTERRA and other companies. And a lot of people started leaving their Lyme antibiotics and venturing over to the essential oils. And over time, most of them did not get better, and they came back to having to use the antibiotics again. Okay. Now, I do believe that essential oils can kill germs. Keep in mind, in Ying Zhang's experiments in his lab, these are laboratory experiments where he gets to bathe the germ directly in the oil. Okay. All right. Part of the reason I think that the doTERRA oils did not ultimately work well for most people is I do not believe they are adequately absorbed out of the intestines and get into the body to treat the infections that we want them to. So my preferred way that somebody should take oregano oil would be to do a true liposome, where again, a true liposome is literally a fat vehicle into which inside microscopic amounts of the oregano or microscopic amounts of anything we want to get in them is put inside. Most of the products you're going to find out there that call themselves liposomal are fake liposomes. They don't use liposomes. They're really just mixing fat into the solution. And I am afraid that is the case with the oregano products out there that call themselves liposomal oregano products as well too. All right. So because of that, I have decided in my own practices, I've looked at this a lot more this week, I'm not going to be using the oregano. My preferred way of dealing with these persister Bartonella and persister Lyme is to start incorporating methylene blue that I'm now using through prescription. Okay. Now, if you have no other recourse, you could try the oil of oregano. The issue again is I'm just not clear if it's going to do that well. If you have it in a pill form, I would recommend taking a pill twice a day. In terms of drops, oregano in the intestines and the stomach can be pretty intense. You might work up maybe to about 5 twice a day on that. But again, I'm not a big supporter of oregano unless we could do liposomes. And no one's really doing true liposomes. They're making fake liposomes. So my preference actually is to do the methylene blue instead that I mentioned earlier tonight. Okay? All right. Thank you for that question, Joyce. Hello, Molly. Hold on here just a minute. Hi, Dr. Ross. In your experience, are antidepressants at all effective treating depression due to Lyme? I've always been naturally cheerful by nature, but after not feeling good for 2 years and treating for 5 months with no improvement to speak of, I'm feeling very discouraged and I'm starting to feel very, very depressed about it all. I know the Lyme is affecting my mood and emotions, but would antidepressants help in this situation? I'm thinking not. Plus, I don't want to really go through the after trial antidepressants, plus then dealing with getting off of them in the end. Thank you so much for your generous help. You're welcome. So first of all, it's really interesting. Depression. I'm sorry you're having the problems that you're having too. It's a hard enough illness, and then to have to have mood get changed by it, that is really discouraging. I know. So in Lyme and in Bartonella. So in terms of both the infections in Lyme disease that can lead to depression, chemically cause depression, Lyme and Bartonella can cause the chemical environment that lead to it. In addition, because people feel badly, that can sometimes trigger a depression on its own, separate from the infections. Okay. Now, what Lyme and Bartonella both do that can lead to depression directly is they cause the immune system to make too many cytokines. And there's good science that shows that cytokines trigger depression, and then depression triggers more cytokines. I mean, it becomes this ridiculous loop. You get more cytokines that trigger depression, and then depression triggers cytokines, and it just goes round and round, okay? And that's why sometimes when people have depression, their Lyme symptoms get a lot worse. Keep in mind, as I've described in multiple webinars, and you see on my website as well too, Lyme symptoms are really excess cytokine symptoms. Your immune system makes too many cytokines, and those too many cytokines trigger insomnia. They disturb how your hormonal systems work. They make you hurt all over. They give you brain fog. They give you fatigue. Those are all cytokines, okay? And so getting more depressed triggers more cytokines, which makes your Lyme symptoms even get worse then, okay? So part of the solution when you're dealing with depression and Lyme is to try to do things to lower the cytokines. And so step one is 500 milligrams 3 times a day of Mariva 500, which is a liposomal, a true liposomal a curcumin product. Okay, curcumin gets inside white blood cells and limits cytokine formation. I also, with my patients that are having depression, like to get them on liposomal glutathione. The product I like for that is Trifortify Watermelon, Trifortify Orange by Research Nutritionals, and I have them take 5 milliliters 1 time a day of that. Okay, all right, those are things to lower cytokines. Okay, now in terms of antidepressant medicines, regardless of whether you have Lyme or don't have Lyme, any one antidepressant medicine that we try on a person works 60% of the time. All right. And yet these things are handed out like candy out there. All right. But if you look at the data about the success of antidepressant medicines, any one will help you about 60% of the time. Now, because one doesn't work doesn't mean another one won't help you. Okay. All right. So I give you a 60% chance that each of the antidepressant medicines you try could help you. All right. Also, I would say the same thing for antidepressant herbs. And if you're going to try it herbally, what I recommend is something called 5-hydroxytryptophan. Tryptophan is a building block for a chemical called serotonin. If we raise serotonin in the brain, that can help alleviate depression. For instance, one of the common prescriptions is a medicine called Prozac. And then there's all the Prozac lookalikes and Me Too drugs that do the same function, which would be Celexa, Lexapro, et cetera. There's a whole group of them, Zoloft, those things. They all basically work by raising serotonin. The way the drugs do it is they block the breakdown. They block an enzyme that breaks down serotonin, so you keep more serotonin in the brain. Okay, all right. But when you look at the data, I mean, the pharmaceutical industry has handed these things out like candy and try pushing them like candy, tries to influence physicians to hand them out like candy. But the fact is each one only works about 60% of the time, unfortunately. Okay, all right. Good luck to you, Molly. Hello, Shaw. Let's see. Diagnosed in 2007, tried Antabuse and thought my head would blow off. Why? Also, my scalp has raised white bumps that are sore and my hair is thinning around them. Looks strange and I have many low levels across forehead headaches. What's happening? Is this meningitis? And thank you for all you do. So Shaw, I really don't know what's happening with those bumps on your hair. Unfortunately, that's something I would need to see to figure out. I can't make give an opinion based on what's written here for that. In terms of the Antabuse, I would need to know more about how you started it. If you started too fast, it may have triggered severe herxes, which gave you a lot of those head symptoms. I would need to know a lot more about what your dosing was, how you got to the dosing, what happened along the way. And unfortunately, this is not a format that we can do that. Okay? All right. Good luck to you. Hello, Molly. Hi, Dr. Ross. What are your thoughts on IV antibiotics? I've been on antibiotics for 7 months now after diagnosis, late Lyme, no appreciable improvements. Symptoms are primarily in my head, no pun intended, significant pressure, thinking neuro-Lyme, though really only in head. Wondering if IV would provide better tissue penetration. Wondering what are your thoughts on IV antibiotics in general? Thank you. All right. So, first of all, let me just make a comment. If you've been on antibiotics for 7 months, one of the things you always have to consider, and I always have to go back and reconsider with my patients too, is what am I missing? All right. What else could this be besides Lyme if somebody's not getting better, especially by 7 months of antibiotics? All right. Having said that, I want to give you another comment. When we look at a little bit of research that's been done about how quickly people turn the corner in chronic Lyme disease with antibiotics. There was a study that was done looking at putting people on 2 oral antibiotics, Biaxin and Flagyl, which is also known as clarithromycin and metronidazole. That study told us, which was non-published, it was presented at the International Lyme-Associated Diseases Society meeting a number of years, maybe even about 10 years ago now. That study showed that by 3 months on effective oral antibiotics, only 30% of people started improving. By 6 months, only 60% of people started improving. And by 9 months, 90% of people started improving, okay? So although you haven't had any improvements yet, that's not outside of what can happen with your oral antibiotics that may eventually work for you, okay? All right. Back to my other comment, though, that if you're not getting better, reevaluate and figure out what you're missing, okay? So first of all, if you continue to have these significant head symptoms and neuro-Lyme, primarily in your head, one thing I would go back and relook at is, are you treating the right problem? Is it just Lyme alone, or is it Lyme and something else? One of the other things it could be with this kind of symptom complex you're describing here is mold toxin illness. I have seen people that have elevated mold toxins, I have seen people not getting better, gone back and tested for mold toxins and found that they were loaded with mold toxins. And that was the thing that continued to look like Lyme when in fact it was mold toxin illness, okay? The best way to test for mold toxin illness is not to do the Shoemaker labs. Okay, Dr. Shoemaker, who I mentioned earlier, is kind of out of date on what he recommends. Shoemaker recommended seeing if people had mold toxin illness based upon whether they had a genetic predisposition, which is something called an HLA-DR test, and also measured a bunch of inflammation markers to see if they had inflammation we might expect with mold toxin illness. The trouble is his inflammation markers like TGF-beta1, C4A, VEGF, MSH, all these chemicals that Richie Shoemaker and his Richie Shoemaker trainees want to do basically may all be elevated because you have chronic Lyme infection in you, not because of mold toxins. So they're not reliable when you have Lyme disease, okay? The best way to see if you have mold toxin illness in you is to not follow the Shoemaker protocol, the Shoemaker trainees, but rather do mold toxin testing of your urine to see if you're peeing out too much. The 2 labs that do that, one is called Great Plains Lab. They have a urine mycotoxin test. The other lab that does it is Real Time Labs out of Texas. They have a urine test too, okay? But if I had a situation like, if you were a patient of mine and I saw a situation like this, one of the things I would do is consider, do I have mold toxin illness? And I would go ahead and get a urine mycotoxin test. Number 2, Bartonella can give you symptoms that look like this. Bartonella often can give you head pressure and significant cognitive impairment neurologic symptoms. So I would go back and reconsider, do you have a Bartonella infection and has it been missed? And I talked earlier tonight about how to diagnose Bartonella, but if you have a lot of Bartonella symptoms, make sure that your treatment has included treatments that affect Bartonella. Okay. All right. So those are just 2 comments. Make sure you're treating the right thing. Second part of that is it just may take more time if the oral's working. Okay. Now back to your question. What do I think about IV antibiotics? I think there's a time and place for IV antibiotics. I think that that if a treatment is not progressing, that it is worth a try of doing IV antibiotics. But again, I would make sure you've exhausted the other possible problems here before you go down that pathway, okay? All right. So what do we know about IV antibiotics? Well, IV antibiotics have a chance of helping, at least in what I see based on my experience. They help about 90 to 95% of the time, and they may get better tissue penetration than the oral antibiotics do and brain penetration too, okay? Oral antibiotics work about 85 to 90% of the time. All right. In my practice, I think of things I like to work with what I call IV equivalent and IV antibiotics. And so IV equivalent means something that works as well as IV antibiotics. All right. So you could either do IV antibiotics, or you could get butt muscle injections of a type of penicillin called Bicillin LA, not Bicillin CR. Don't do the CR. It doesn't work as well, but Bicillin LA, and you would get butt muscle injections about 3 times a week. Another IV equivalent treatment is to use super, super high doses of oral amoxicillin. And by that, I mean, if you're going to use amoxicillin, for instance, if you have a cold, I'm sorry, not cold, but like a strep throat infection, you might use it as 500 milligrams 3 times a day as an adult. That's 1 pill 3 times a day. When I'm talking about using high doses of oral amoxicillin to build up super high levels in your blood so it forces its way into the brain, that for an adult my size, which is 5'7", about 170-ish pounds, that would be a total of 4 of the 500 milligram pills 3 times a day, okay? Who I got this idea from is Dr. Ken Liegner, and Dr. Liegner is the person that brought us the Disulfiram case reports that got everyone excited about using Disulfiram. That Dr. Liegner, okay? Dr. Liegner in his practice had a lot of people with severe Lyme and multiple sclerosis, and he found, based on his experience, that high-dose oral amoxicillin can work as well in his MS patients and neurologic Lyme patients as doing IV antibiotics. Frankly, I see the same thing. I have seen some people with multiple sclerosis in my practice that IV antibiotics did not help, and when I switched them over to high-dose oral amoxicillin, they got better. All right, so it's a valid way to look at doing things. I'm going to show you in a minute where you can see information that I have about what I call IV and IV equivalent treatments. Okay, now, and then let me say one more thing. On the East Coast of the United States, the doctors out there tend to be a lot more rapid about moving to IV antibiotics than we are on the West Coast. The West Coast school tends to be more into oral antibiotics. The East Coast schools tend to be more into IV antibiotics. Frankly, we don't know who's got the better approach. We really don't. We have good results on orals out here. They have good results on their IV antibiotics out there. You have to keep in mind with IV antibiotics, there are risks in doing them, okay? Number one is the financial risk. Insurance companies often will pay for 1 month only, and after 1 month, you're stuck paying it yourself, and they get to be very expensive, okay? The second problem with IV antibiotics is that you often are going to have a type of IV line put in that's left in place, and that's called a PICC line, and those PICC lines can get infected. The other thing that can happen with those, and that leads to a blood infection and from normal bacteria, okay? Second problem with IV antibiotics is that PICC line can sometimes get a small blood clot that forms at the tip of it. And those blood clots can break away and float downstream into your lungs and kill part of your lungs. That's called a pulmonary embolism. Those risks of either infection or pulmonary embolism happen about, I think the studies say if you're on it about on a PICC line for about 6 months, you've got about a 20% risk over that time of having one of those complications, okay? So because of that, I don't like going to IV antibiotics because of cost and the complication rate. I usually reserve it if my oral antibiotic treatments are not working, okay? All right, so I hope that gives you some things to think about. Let me go ahead and do a quick screen share here for you. And I'm going to show you where you can read information about IV and IV equivalent antibiotics on my website, okay? All right, so this is again back at my Lyme disease information site, Treat Lyme by Marty Ross MD. Take a look at my infection treatment plan section. Take a look at my Lyme disease antibiotic guide. And then down here towards the bottom is a section I call special considerations. It's part 4, and it is called IV versus oral antibiotics. Okay. And then then IV equivalent treatments. And this is where I spell out how you can use bicillin and how you can use the high dose amoxicillin too. Okay. All right. All right. Molly, thank you for that question. Good luck to you. Hello, Marcia. Let's see. Is it better to take antibiotics at a specific point of an herbal protocol? Maybe to use herbal and homeopathic remedies first and kill persisters with antibiotics? Marcia, I don't think there's a general rule of thumb. I base my decisions, for instance, with my patients based on talking with them about what their own preferences are. I discuss with them the greatest chances that either one of those could work. And then sometimes, frankly, we just got to tap into intuitively what a person knows will work with them. So, for instance, one of the things, as many of you know, I'm an integrated medicine doctor. So when I first started doing this, I was working with acupuncture in my practice. I was doing herbal medicines. I was doing supplements. I was doing prescription medicines. And well before I ever moved into treating Lyme disease, I was doing family medicine using all of those. And I used to wonder, how am I going to help people figure out what is the best thing for them to do? Because they could do acupuncture, they could do, all these different things. And what I quickly learned was to get out of the way. I quickly learned that what my role was to offer ideas and then offer it to patients. Say, you could do this and it has this chance of working. You could do this and it has this chance of working, and you could do this and it has this chance of working. And then I would see what their reaction was. And what I honestly believe is, I think intuitively we all have knowers, our own gut reactions that sometimes guide us. And so, for instance, there are patients that I see that will say, that one intuitively, or that one in my gut is the one that I think I should do. And what I would tell you is trust it. I think we have knowers, and I think they can give us guidance on this. And so that's the kind of thing I would think about doing here. I don't have a specific answer for you. These are the kinds of things I talk with a person about and answer their questions and see what resonates the best with them. Okay? All right. Thanks for that question. Good luck to you. Hello, Geraldine. Let's see. Does sense of taste sometimes become altered when you have Lyme? My stomach has not been good with antibiotics, but wondering about the sense of taste, if it will return to more normal with recovery. Geraldine, I've had a few patients in my practice that have had altered sense of taste as part of their Lyme that did get better as we treated. Okay. I can't guarantee that's what's going to happen with you, but I have seen that happen a few times with my patients. And it's only a few that I've had that kind of a situation occur in since treating Lyme since 2004. Okay. All right. Good luck to you. Hello, Brenda. Let's see. Hello, Dr. Ross. I have Lyme disease and I'm struggling with migraine headaches. What can you recommend to prevent and ease the pain once the migraine has begun? Thanks. Boy, Brenda, that's a tough one. So the best thing to do with migraines is to prevent them. And I'm going to start there. I know you're not asking a prevention question, but to be thorough for everyone listening in, I just want to talk about migraine prevention, okay? So in terms of migraine prevention, what I usually recommend to people is to decrease caffeine intake. Although some people, their migraines get better with caffeine, and you'll know if that's your situation, okay? But decrease caffeine intake. I also suggest decreasing alcohol. The other thing I suggest is being on regular magnesium, and that can be magnesium malate or magnesium citrate or magnesium glycinate. And you want to take about 400 to 600 milligrams at bedtime. Magnesium will make you sleepy. So it's good to take a bed. All right. But also magnesium is shown to decrease the occurrence of migraines. Okay. All right. Most of us are magnesium deficient because our nutrients these days, even in organic farms, our food is nutrient deficient. Okay. So migraines can be helped preventively by taking regular magnesium. The other thing that can be useful to have on hand is a prescription medicine made up of one of the triptans, like sumatriptan. And that would be a pill you can take right at the initial outset that you think you're going to have a migraine, because it can break a migraine from happening. Once you have the migraine, there is really not a good way to break it, other than sometimes I have seen benefits in acupuncture making a difference. But the triptans, once the cat's out of the bag, there's not much you can do. Sometimes you just even need narcotics for them, to be frank with you. Okay. There is one other preventive thing that you could do herbally, in addition to taking magnesium, and that is to take a supplement called Butterbur. Butter and then burr. All right. And there's a product I have on my supplement store, Marty Ross MD supplements at treatlyme.com, which is called Petadolax by, I believe it's Integrative Therapeutics. It's an Integrative Therapeutics product. And Petadolax is Butterbur, okay? And you take 50 milligrams 3 times a day. It's been shown to be as effective as prescription preventive medications, like being on the prescription prevention medicines are either to use high blood pressure medicines, or to use a group of antidepressant medicines, or to use a group of anti-seizure medicines to prevent those headaches from happening. Okay. All right. Let me just do a quick screen share in case you're having a hard time finding that. So let me show it to you. All right. So everyone, this is my supplement store. It's Marty Ross MD supplements. Anyone can purchase their supplements from here. It's not just for my patients. Okay. Anyhow, in terms of the Butterbur, this is my Butterbur product, which again is called Petadolax. Okay. So that's what I was talking with you about. All right. Brenda, good luck to you. Hello, Irina. Dear Dr. Ross, so happy to be here to listen to your webinar. Oh, we already answered that one earlier. Hello, Lynn. Let's see. I have a history of Lyme, Bartonella, Babs with some hanger-on symptoms. I like the way of saying that. With some hanger-on symptoms that do not affect everyday life, but I would like to get rid of once and for all. These are mild chemical sensitivities, red lines on my legs that seem worse when I am cold, and I consider Bart rash type symptom, swollen ankles, occasional flare of foot pain. Seems like Bartonella mostly, and I wonder what you feel would be the best approach in tackling this. Question is, do you think it is best to tough it out for a few weeks with rifampin plus doxymino or other antibiotics if I tend to have stomach issues? Or better to ramp up slowly with herbs and be able to do it longer? Do antibiotics or herbs tend to have more lasting results if the symptoms go away? And if I'm trying to get rid of these hanging on symptoms and think it is largely Bartonella, if I do herbs, does it make sense to also take Lyme herbs and Babs herbs to cover all bases? Can all those herbs be taken at once along with the Ross immune support and yeast buster? Thanks. So to answer the last part of your question, yes, you can take them all together as part of the Ross immune support and with the yeast busters. You can. Okay. Now, in terms of if you keep having recurrent Bartonella symptoms and you can't get rid of them, regardless of whether you decide to use an herbal protocol using the Sida acuta and Hutania that I talk about, or a prescription protocol using rifampin and 1 or 2 other prescriptive antibiotics, I would make sure that you're using one of these new persister agents that I was talking about that Petri dish experiments tell us may help. Okay, I hope you heard the word may, because we don't have human experiments yet saying that they do help. Okay, so regardless of whether you use herbal or the prescriptions, I would get a prescription from your physician, have him or her send it off to Hopkinton Pharmacy in Massachusetts, and that is for something called Methylene Blue, 50 milligrams, 1 pill twice a day, because that seems to have activity against persister Lyme and persister Bartonella. In this case, more for the persister Bartonella I'm talking about, okay? If you were to do prescriptions and you keep having recurrent symptoms, I would think about using 3 prescription antibiotics in addition to the Methylene Blue. And I would likely do, let me see what you wrote here. I would likely do a rifampin along with a azithromycin, and I might use a minnow or a doxy with that. I would do those 3. If you have GI issues, though, of an upset stomach, you could do a rifampin, azithromycin, and the sulfa antibiotic called Bactrim would be a way to do a triple antibiotic regimen there too. Okay, all right. I think this is something you could ramp up slowly if you need to, but you could also just go ahead and take them all at the same time. If you are having recurrent Bartonella, you're going to have a better chance getting rid of it if you were to use prescription antibiotics than doing the herbal antibiotics. Herbal antibiotic regimens for Bartonella tend to work about 70 to 75% of the time, and the prescription options tend to work about 80 to 85% of the time. So my practice when I get Bartonella relapsers, people that I just can't seem to get rid of all the stuff, is to go 4 to 6 months with a triple prescription antibiotic regimen. And more recently, I am adding to that the Methylene Blue, because it has Petri dish experiments that suggest that it might deal with persister Bartonella forms, while the prescription antibiotics tend to do a better job dealing with the growing forms of Bartonella. Okay? All right. Thank you for that question. Good luck to you. Hello, Lisa. Hi, Doc Marty. I'm coming to see you in about 3 weeks. Well, welcome here. I hope our rain stops by then. We have had, yes, it rains a lot in Seattle, but we have had really bad rain the last week. It's been just pouring out constantly. So I hope it dries up by the time you get here. Let's see. I'm currently not being treated by anyone and nervous the suspected BART is multiplying due to my current symptoms. Should I start taking something like herbals in the meantime? Or do you usually retest your new patients? I tested positive for BART via IGeneX less than a year ago. Thanks for all you do. So in terms of Bartonella, there's no advantage to retesting, okay? And if you think your Bartonella is getting more active, I think it would be reasonable before seeing me, if you are coming out to see me, to look at doing the Sida acuta and the Hutania. Okay, I think that would be a reasonable thing to look at doing. And I, as you know, I've written down how to do that on my Lyme disease information site, so you could follow what I described there. Okay, all right. Good luck to you, Lisa. I look forward to meeting you. All right, bye-bye. All right, everyone. That's actually it for me tonight. I actually been kind of struggling with a cold today, and I'm just worn out. And I know I'm 5 minutes away from being done, but my inside, I'm just saying, that's it. I've got to go home and take care of myself and just kind of get some rest in here. So thank you for being here tonight. I've enjoyed answering your questions, and I hope you've gotten something meaningful out of it, and we found some ways to help improve your Lyme disease treatment. Keep your eyes out on the email tomorrow morning, somewhere between 9:30 a.m. Seattle time, which is Pacific Standard Time. You'll get an email from me. And again, if you miss it, look for the recording. If you don't get my email, feel free to look for the recording on the webinars page at treatlyme.net or at my supplement store, Marty Ross MD Supplements, or on my practice website, which is called Marty Ross MD Healing Arts. You'll find it on the front page of all those. Okay? All right. Also, in tomorrow morning's email, you'll get an email saying when we're going to have the next series of webinars, and they will be in February. I'm trying to decide at this point. I know I'm taking next week off, but I actually have a medical conference I'm going away to, and I've got to double check whether I'm going to be back in time to actually to begin the first week in February with another webinar or not. So you may see that I'm actually off for 2 weeks, but in any event, I'll figure that out when I set up the next schedule. But in tomorrow's email, there will be a link to sign up for the next series of webinars as well too. Okay. All right. Thanks for being here, everyone, and good night.